Everybody, and thank you for having me this afternoon, for spending the Friday afternoon together. And I want to thank all of you for your volunteer work. All of us at CARIE sincerely appreciate all that you do to help not only spread the word about preventing Medicare fraud, but letting people know about us and what we do. We value you, so thank you. Today we're going to be talking about the public health emergency unwinding, specifically in Pennsylvania. This is going to be happening all across the country. And again, it's going to be a very high level overview, but we'll be glad to answer your questions. This is our general slide and my contact emails on here. If at any time you have questions about this presentation or the unwinding, feel free to contact me. This is the basic agenda for today. Some of this is going to be very quick, but this again is going to outline of what we're going to be talking about. So back in January of 2020, that was when the initial COVID-19 public health emergency began. Since that time, it's been renewed every 90 days. Multiple times from then until now. And this public health emergency has allowed a lot of flexibilities and changes in rules and regulations in order to respond to the crisis. And so some of those policies and procedures are already beginning to unwind, so to speak, or get back to normal. But what we're going to be talking about today is a massive undertaking that's been caused by what's mentioned here, that during the public health emergency, states must provide continuous Medicaid coverage to people that were either enrolled when the public health emergency started or were newly enrolled during that time. So this was definitely a change from normal operations, and I'll talk more about that in a moment. So in return for not disenrolling anyone, states got a higher federal reimbursement rate for Medicaid. That's called the FMAP, or the Federal Medical Assistance Percentage. And Medicaid, as you all know, is a state and federal partnership. So states have to follow what the feds tell them to do, but there is flexibility with certain provisions under Medicaid. So every state Medicaid program looks different. So when the public health emergency officially ends, so will this continuous Medicaid coverage policy and this increase in the federal Medicaid payment. So unwinding means getting back to normal operations, procedures, policies, and this is going to bring a lot of, this whole process is bringing a lot of uncertainty to states, to Medicaid recipients and providers. And we'll be talking about some of those issues. So CMS, and you all know, I always try to be careful with acronyms, but I know as Medicare fraud folks, you know CMS, the Center for Medicare and Medicaid Services, to give states a 60-day advance notice. This will be a public notice. I don't know if someone could be muted. I don't know if I was the only one hearing feedback. Anyway, so is that just me or?
No, if folks who are on the call, please mute yourselves, both lines, especially if you're calling in on your phone and on the computer.
Okay, I think we're good now, right? Okay, so anyway, there's going to be a public notice, and again, within these public health emergencies, 60-day in advance of when it will actually end. So more background, and like I said, so Medicare, more and more people were being enrolled in Medicaid during this pandemic. None were disenrolled, or very few were disenrolled, and states weren't required to complete their redetermination process, which is part of normal operations. Pennsylvania continued to implement the redetermination process, and I'll talk more about what that means. But they did not disenroll anyone who maybe, whose paperwork came back, perhaps showing that they may no longer be eligible. So the redetermination process is something that typically happens once a year in Pennsylvania, where any Medicaid recipient needs to prove they still meet the eligibility requirements. And there's all different kinds of Medicaid programs, all different types of requirements. But for whatever Medicaid benefit they were receiving, they have to, everyone needs to continue to prove that they are eligible under normal operations. So once the public health emergency ends, states are going to have 12 months, and they can choose to do less. And I can tell you, up till about a week or so ago, Pennsylvania was going to try to do this in 6 months, which we advocates were really pushing hard against. And we just got good news that they're planning a 12-month unwinding plan. So it'll still be challenging, but 6 months would have been a huge disaster to try to get all this work done, especially with the increasing numbers of cases. But anyway, so they're going to need to start a redetermination process on every Medicaid recipient in Pennsylvania. But the lack of that extra money, and that's why Pennsylvania was originally planning 6 months, puts pressure on states to really disenroll people who are no longer eligible as quickly as possible. Even if a state has information that makes them believe that the person's no longer eligible, they can't just automatically disenroll. They have to go through this redetermination process, because with instructions from CMS, people's situations change all the time. So, and they want to get back to, again, the formal rules and rights that people have when they lose Medicaid coverage. So everyone's working together to try to really minimize disruption in coverage when the public health emergency ends. So there's a lot at stake, and the article Rebecca shared with the link to this webinar, I actually included again, because I knew it contained this information I have on this slide, was actually updated. So I re-put that here for you. But this shows you anywhere from 5 to 15 million people are expected to lose their Medicaid coverage. And this is people of all ages, children through older adults, and about almost 7 million are likely to still be eligible for Medicaid, but yet will still lose their coverage. And part of that is what I have here when I talk about churn. And churn, and there's others that lose it permanently because they don't bother to reapply, or there's a whole host of issues. But anyway, churn was a big problem prior to the pandemic, and we expect it to be once we get back to normal operations. And that's when someone temporarily loses their Medicaid coverage. And there's a lot of reasons. And the primary one for older adults is that they have difficulty getting all the paperwork in on time to continue their coverage. And some cases, our CARIE line has helped people that have submitted paperwork more than once, and it gets lost. And again, those delays end up making them ineligible because they don't get everything in by the deadline. The other issue I want to talk about what is at stake has to do with the Supplemental Nutrition Assistance Program. Some of you may know this is the food stamp program. And right now, during the pandemic, the public health emergency, folks are getting a second payment every month in extra benefits that has increased the amount of money that gets on their cards to purchase food. And once this public health emergency ends, there's going to be a lot of folks not only losing their SNAP benefit, but they're going to see a dramatic decrease in the amount they receive. And we all know how much groceries are costing nowadays. So this is really going to impact hunger, again, for people of all ages. So some of the common barriers people have when applying and going through the renewal process to keep their benefits is very long, complex forms, the notices they receive. Older adults in particular may lack internet access or digital literacy to complete things online. So they have to do everything with paper and mail or going to a county assistance office. There's mail delays, and some zip codes are much worse than others. Lost mail delays, and that can really, people are on the clock when this process starts, so that can really impact people. Again, as I mentioned, some things are lost. There's language and literacy barriers, and even terms like public health emergency, that doesn't necessarily resonate with someone to think, well, that doesn't really have anything to do with me. I'm not, and a lot of older people just don't have anyone to help them, get through everything that needs to be done. So one of the categories of Medicaid, you're probably familiar with community health choices, and community health choices, for those who aren't familiar, is Pennsylvania's Medicaid managed care plan for people that have both Medicare and Medicaid, and also those who require long-term services and supports, whether in a nursing facility or in their home. This is the most complex application and renewal process out of everything in Medicaid, because people, as you can see here on this slide, they have to every year go through a functional reassessment, meaning they have to still be in need of a care that would be a very high level of care, like one would need in a nursing facility, although again, people can get those same services at home, but still have to meet that criteria. And then the income and resources they go back 5 years, and there's all kinds of paperwork that people have to get through to apply, and this can take months. Again, and then once you're enrolled, you have to go through this every year. Although during the pandemic, this has not occurred. So when the public health emergency ends, a lot of people are going to be going through this for the first time, and it's a daunting a task, to say the least. So usually 90 days before someone's renewal date, they'll get a flyer or a piece of information from the county assistance office letting them know the financial piece of their redetermination is going to occur. But then about 60 days before their due date, the financial piece starts in earnest. The functional side may not always align with the same date as the financial redetermination. So that further complicates things. And so again, that also has to be done on a yearly basis for people, again, to continue to receive coverage. So if someone doesn't return the information, or again, if what they return proves or their evaluation proves that they're no longer eligible, they will be terminated. For people that don't get all their paperwork in on time and are terminated for that reason, they have this 90-day, what they call a reconsideration period. So if they get their paperwork and their documents in within 90 days, after their termination or end date, they can get reinstated if everything's in line. If they go beyond 90 days, they have to start the entire application process all over again if they want to get this care. So I'm going to go through a timeline in a minute, but each state Medicaid program has to start this, like I said before, process for each recipient within 12 months and have to complete it within 14. But once they get the 60-day notice, states can start this process within those 60 days, but their clock for that 12-month and 14-month limit starts whenever they start this process. And so they can, if they start the process the same time they get notice, they could potentially begin disenrolling individuals at the end of the same month the public health emergency ends. So every state is working on a plan. Some have completed, but they're refining it as they get more information. All have begun outreach to recipients, urging them to keep their addresses up to date, because when people move, they don't get their mail, they don't get these notices, and they get terminated. And unfortunately, a lot of people on Medicaid tend to move more often than others because of issues related to poverty, or in the case of, someone older that is in need of care, they may need to move in with a relative or, change their situation. So the change of address is critical, keeping that updated. So here is that timeline I was referring to you. Now, don't look at these dates as dates for certain, because we do not have a date yet when the public health emergency ends. This chart was generated based upon if the current public health emergency is extended when it ends in January for another 90 days, as it has since January of 2020, or when the pandemic began. This would be the outline for that timeline, but it still gives you a sense, regardless of whenever it ends, of what's going to be happening within those months. So if the public health emergency is renewed, and typically the way the patterns work in the past, they renew it a couple of days or a day before the current one ends. And then, like I said, it's going on, and then everyone holds their breath at day 30 to see if it's going to be over because of that 60-day notice that was passed. I can tell you that something passed in the Senate, and again, this gets back to uncertainty. U.S. Senate, I think it was yesterday. I haven't had time to read everything about it, but basically they voted to end the public health emergency, and this was a bipartisan vote. What I'm hearing is Biden would veto that if the House happens to take it up in the lame duck session and pass it. So I think in general, the public and a lot of public officials are over with the pandemic. but your hospitals, your nursing facilities, and other healthcare, community center, clinics, etc. It's a different story. They're still not recovered and really benefit from a lot of the other flexibilities, and also for providers, the consistency of having people insured and not dealing with people that, where they're either not going to get paid or there's a lot of delay in their payments. But anyway, this goes through some of the things that I've talked about so far, this timeline. I have a couple of slides here, and I believe Rebecca will be sharing the slides with you, so you'll all get a copy of this after the webinar today. But these are some of the digital communication slides that the Department of Human Services has developed. And again, I'm going to take you to where you can find more information. They're also doing flyers and phone, messaging and things of that nature. But this is basically their messaging at this point now, is to really make sure people are keeping their contact information up to date, which is a massive task when you're talking about millions of people on Medicaid. There's folks that can connect with the department through Compass, and again, which is online or on a cell phone, and you can do a lot. You can apply, you can update your, in terms of your redetermination, you can do a lot of that online, submit forms online or on the phone digitally, and also get this messages. But people do have to opt in to get text or email messages. And of course, not everyone has, access or ability to use this, but nonetheless, they're going at people with messaging in every possible direction. The other key message right now is to start reminding and educating people that they're going to have to go through this process every year once this public health emergency ends, and the importance of that and the risks of what will happen if they don't follow through. So this is a message for that. I thought I had 3. Oh yeah, okay, I'm sorry. Future communications, it's Friday afternoon, I'm sorry. I can't count to 3, you're in trouble. Future communications will include, more details on how to complete the renewals and the deadlines needed, and options if you lose, if someone were to lose their Medicaid coverage. We've already talked about reconsideration. They can still have a window of time to get that paperwork in. Appeals is if they're terminated, there's rights to appeal. They get those instructions. We always recommend people get a lawyer, a free lawyer, which we can help refer them to help with those appeals if they are indeed truly eligible and denied for, a particular reason. And then the other key area, we know some people are simply not going to be eligible. And how can we get them from Medicaid coverage, instead of going to no coverage, to transition to other coverage and benefits that can help with their care. So the managed care organizations, Pennsylvania has Health Choices, which is the physical Medicaid managed care program for adults, and again, up to Medicare age, and those that aren't dual eligibles or needing long-term services and supports. Community Health Choices, which we've already talked about, and there's also like behavioral health choices program too. So they're all Medicaid managed care organizations. Some of you are probably also familiar with LIFE, which is a program in Pennsylvania, which is for people that have both Medicare and Medicaid, older adults. And anyway, so they're all being educated and involved. They're receiving data about what information The state has on record in terms of their particular participant status. They're sharing renewal dates now, which was a big problem before. They didn't necessarily know when they were going to be up for renewal. And so the service coordinators and nursing home providers, they're really going to try to help folks get through this process, and they're going to need that help. I know some of you are also PA Medi counselors, and I'm sure as a prize counselor, you're familiar with the DSNPs, the dual special need plans. And they're also being told to coordinate with the CHC MCOs, and again, to help people maintain coverage. So again, the goal is to help people get some type of coverage if they're no longer eligible for Medicaid. Most of the people we're talking about are going to be adults and children, and they will, some may be eligible for Pennsylvania's healthcare exchange, which is called Penny in Pennsylvania. And some children that are on Medicaid may be able to transition to CHIP. So there's a lot of work to try to help, will help try to move people as seamless as possible into those programs. The DSNPs, and again, I don't have an update on this. We're still waiting for a clear answer from the state, but DSNPs under federal rules are allowed to implement these deeming periods, which allow members who lose their Medicaid eligibility to maintain their enrollment if they're expected to regain that coverage within a few months. So again, that might be another important option for people, because obviously if someone's in a DSNP plan and they lose their eligibility for Medicaid, that means they're going to lose coverage in their DSNP plan. Unless again, there's this deeming period that's authorized and allowed. So we're also probably going to see an increase in need for lottery funded programs and services like PACE and Options and the Family Caregiver Program, or the Caregiver Program, sorry, and other Older Americans Act programs. And so the system may be, was already overloaded now, and it may not be able to absorb additional people in need. So transitioning to Medicare savings programs is another transition. In Pennsylvania, these programs are called Healthy Horizons. Some of you may know them as the QIMBYs, the Qualified Medicare Beneficiary Programs. There's a few of them. And this can help folks that may lose full Medicaid coverage get some help with their Medicare premiums and cost sharing. And also some folks may be eligible for extra help, which is the Medicare low-income subsidy for prescription drugs, which people on Medicare or Medicaid are not eligible. And the other thing that's happened, and again, the PA Medi folks know this, that some people that become eligible for Medicare miss their initial enrollment period into Medicare. And some older adults and people with disabilities who were getting Medicaid since the start of the pandemic and not disenrolled may have just either decided, oh, I don't need to sign up for Medicare, or may not have realized they needed to sign up for Medicare. So they're going to need to learn about special enrollment periods and their options and things of that nature. And PA Medi is the right source for those folks. The one thing I can tell you, there is a proposed special enrollment period that's supposed to be finalized by to be in place in January. I don't think it's been formally approved yet, but it would create the situation where someone who did not enroll because of this, continuous Medicaid coverage situation. In other words, creating another special enrollment period for that. But I believe the proposal was only for 6 months, starting in January. So again, more to come on that. And I'm sure the PA Medi folks will receive further instructions and education once that is finalized and approved. And again, we talked about folks that might need, who may lose their dual special needs education. So some advocacy tips in terms of unwinding. Pennsylvania is still working on their unwinding plan, but I'll show you in a minute where you can learn more about hopefully where that will be posted or what they're proposing so far. But keeping up to date on that. Understanding the renewal process, just even in the sense of the importance of deadlines where people can go for help, get questions answered, help navigating, help spread the word with the key messages, like keeping contact information updated. And this whole process is going to occur. I've heard it compared to when the Obamacare or the Affordable Care Act was initially passed and millions of people going on and trying to enroll for the first time. And this is analogous to that, because this is a massive undertaking for states, even though they're accustomed to doing renewals. The increased numbers of people that have to go through this process is that, the structure's just not set up to accommodate that. And again, there was always issues before, even before these massive numbers need to go through, this process. And so again, the other fact, the county assistance office do other work. They process new applications. They process things like LIHEAP, and again, like I said about the food stamps or SNAP benefits. So there's no shortage of work for the local county assistance offices. But getting back to advocacy tips, and again, I'm going to have resources in these slides to help you about knowing where to turn. Of course, CARIE is always among those you can refer folks to. So this is Pennsylvania's PHE Unwinding website. I also have it on the resource slide at the end and in the title at the top. And I did a screenshot just so you can kind of get a sense of all the things. I couldn't get everything on, but you can kind of see here all the information. You can actually see communications that are going to be sent to MA recipients. There's webinars and videos on the renewal process. So you really can, and the stakeholder toolkit is where I took those 3 pictures of, so again, there's other information and messaging in there. So again, this is really your go-to and a good resource to refer others to as well. On that site is something called PHE Helpers. And the Department of Human Services has identified helpers. And basically what it is you sign up on this portal, and then you'll get newsletters, periodic newsletters with updates and, with new information or resources to share. And so basically, being a helper is like just sharing this outreach and education information. But even if you don't actually share it, you just want to receive this information, you can sign up via that link. And again, I have it on your resource slides at the end. The other, and this is the Compass Community Partner. This has been around for quite some time. For those of you who are not familiar, Compass is Pennsylvania's web portal where people can apply for Medicaid benefits. They can create accounts and monitor their application. They can do the renewal, things of that nature. But the community partners are really for organizations that that help people apply. So they can go in. So for example, if I'm a social worker from Catholic Social Services, I may have an account, then I can help my clients put their applications in, and then I can go in and monitor where they are and what other follow-up might need to be done. So again, you can start and track applications. But again, this is not something I would recommend. And again, there's an application you wouldn't successfully, I think, be approved unless you were really someone or an organization that's actually helping, with more than one application on a regular basis. So again, we're about to wrap up for your questions, but I have some national resources here. This first resource is CMS's key Medicaid website. This is something to go to for states and others that really want a high level of detail about this whole process and rules, et cetera. And then I have a couple of other websites that have that are more, the next two are more advocacy oriented. At Georgetown has a large focus on children, but there's still good information on their website. And then again, because this was a link that was originally shared, but since it was updated, I put it on again, and that's just a nice top 10 things to know. Resources for Pennsylvania, again, I put the portal there for you at your fingertips, and I have other key resources here for folks. And I just want to point out a couple at the end that not everyone's aware of. There's the prescription price finder. So someone that might be losing benefits, anyone of any age in Pennsylvania can go on, you put your medication in. And this is, I think, from a lot of PACE data, they have come up with prices. So people can actually go to the most affordable place to get a particular prescription. And sometimes that saves folks a lot of money. And then the Pennsylvania Patient Assistance Program. Although this is a program more or less run by the PACE program, this is really for people 18 and over, residents of Pennsylvania, and they help get people connected with all types of resources, including prescriptions that they perhaps can no longer afford. And then, of course, I've got CARIE. I have 2 legal service providers that can help with appeals and access. Community Legal Services of Philadelphia is strictly for folks in Philadelphia. Pennsylvania Health Law Project is statewide. They both serve people of all ages. And the last is FAN, or Pennsylvania Health Access Network, and they do a lot of work with navigation with Penny and the CHIP program. And with that, I'm glad to take any questions. And I'm going to stop sharing my screen, and I can always go back if you need to see a slide.
Okay, thank you, Kathy. Peter, you mentioned Life actively marketing. Do you want to talk a little bit about that? And you are muted, by the way.
Yeah, thank you very much. Yeah, I'm actually very disturbed, at least in this community of Northwest Pennsylvania, with the Life program. I've experienced over the last couple of years as a counselor, PA Medi-counselor, having clients transferred into that program and not really understanding anything about the benefits, contracting. They actually had better Medicare Advantage plan coverage. Some of them actually were duals. And so I've looked up a little bit that I could in the looking under Pennsylvania government and services and so forth. I don't understand anything about the program, how people are enrolled, the marketing of it. We're starting to get marketing on TV.
Sorry, say it again.
I don't have an opportunity. to talk to a client, they just suddenly disappear. And I really am upset. I think as a CARIE person, I think this has a high potential for fraud and abuse on both financial and medical perspectives. And that's my story.
I missed one thing you said, but I got the gist of it. Well, a few comments, and I think you're raising important points, and I know the SMP staff at CARIE will take that seriously. But a couple things I can speak to. One is nationally, the LIFE program is known as PACE, and
Yeah,
which
right.
is an acronym for Program of All-Inclusive Care for the Elderly. Because in Pennsylvania, the PACE acronym for older adults was already captured by our pharmaceutical benefit, they went with LIFE. So there is, it's been a long time since I've looked, but on, the Department of, Health and Human Services website, if, searching through, for PACE, or again, Program All Inclusive Care for the Elderly, there should be, in terms of research that I know our staff here can do to learn more about what those marketing rules are. I don't know offhand. It's been a long time since I've looked at that. The other point I can say in terms of enrollment, it's probably been a year and a half. This did occur during the pandemic. Before LIFE programs did their own enrollment, but right now it changed, and again, it was about a year and a half ago, that they now need to go through the independent enrollment broker, and which is Maximus. So anyone that's applying for Medicaid long-term services and supports is supposed to be educated about LIFE as well as community health choices. But I know there was some concerns, which I think you're alluding to, with how people were being enrolled in LIFE by certain providers. And this was a step that the Office of Long-Term Living, which manages LIFE, did as a strategy to try to mitigate some of that. But it sounds like you're talking about more recent occurrences.
Absolutely. And I am very concerned. I met just last week, I actually was doing a CARIE presentation, and I met 3 people that had been enrolled, that we were in a small elderly housing. Mostly it was assisted rentals and things like that. Very nice people. And they did not understand the program. Oh, they were happy because they went to a social thing and this and that. Oh, sometimes the primary care is not available, but that's okay. They had no idea what their rights were. They didn't know how to get in or get out again. I mean, I just can't tell you how disturbed I am. As a PA Medi counselor, somebody comes into my office, I spend an hour or 2 hours explaining their benefits, giving them choices. That doesn't happen. They don't understand what their choices are. And I think it's a program that's just ripe for abuse, and both financially. I mean, there's a financial interest in this thing. So there's a conflict of interest right from the beginning. And of course, when you have something like that, medical abuse or healthcare abuse is very likely. Anyway, I can only raise the issue. It needs serious study. Thank you.
And if there are cases that get reported to the PASMP, I can take them to the key people at the Office of Long-Term Living, and but again, I think like you said, it's going to take a little more research, and but it's something that should be looked at and addressed.
One other thing, it's very unclear who is responsible, and from a state agency perspective, for actually auditing them. You got to get out, kick the tires, look at the records, interview people, look at the finances. I think it's just a potential time bomb, at least here in this community. Thank you.
Dan, thank you, Peter. Dan sent in the chat, make sure to check that because there's a link, PACE marketing guidelines attached in the document. Okay, any other questions or concerns or comments for Kathy? Okay, Kathy, it is ending a little bit before 4. So timing, thank you very, very much. I will share this recording with the volunteers. I know that there are some people who could not make it, like me, who is very looking forward to seeing this. So yeah.
I held back, but I have another question because we don't, in Venango County, our relationship with County Assistance Office is spotty, and no idea why. But one of the things that falls through the cracks is as those who have assistance lose it and suddenly need to change their Medicare enrollment, maybe be reevaluated, all of those things. We find that that's not really happening on an automatic basis. The people at the county assistance just don't seem to understand that part. All they need to do is refer these patients with clear information to us, and we'll carry what our responsibilities are. But we have people coming to us who just, it's a last ditch, last grasp thing, and they don't even know why they've been referred or what's happened to them. Suddenly they lose their dual status and all the benefits that come with it. It's an issue of what kind of responsibility is being, here you're giving us information, what kind of responsibility or education is happening in the county assistance offices, because they just seem to be clueless. Thank you.
Well, I think you're raising concerns. We have, and I've been part of a stakeholder group working with, the Office of Medical Assistance Programs and Income Maintenance about this transition. And to be honest with you, the main focus seems to be getting people a warm handoff to Penny, as much as we're still pushing for, a lot of the things I went through on the slides about where where older and Medicare folks could potentially get support. I do know that at the higher level in the state, the Department of Aging, which, as you know, is responsible for PA Medi, is in different conversations with the Department of Human Services, which operates the Medicaid program. And the Pennsylvania Health Law Project, they also do a lot of training for PA Medi. But I think part of the problem you're describing, there's a couple of things. One is that a lot of the caseworkers are so overloaded that they're just trying to process as many cases and their paperwork and things of that nature. So not that that's an excuse, but I think that's in part of why folks aren't getting, that additional information. And the other is that, unfortunately, when you have things that are outside of the Department of Human Services, like aging programs, they're not always coordinated as well as they should in terms of getting the same message to folks like they are about getting information about Penny, because even that web portal I shared with you, you don't see PA Medi on that web portal. Now, part of that, I think, is also that PA Medi might not be able to handle a real heavy outreach. So I don't know what the Department of Aging is telling Department of Human Services. I do know they're at the table, but I'm not hopeful that there's going to be a satisfactory resolution to the issue you raised, but we continue to push.
Thank you.
Okay. Kathy, I think it looks like that's about it. Appreciate your time, appreciate everybody being on here. I will share the slides and the recording with everybody. If anybody has any follow-up questions that they need, email me and I'll kind of triage to whether or not it's something that needs to go to SMP or something that needs to go to Kathy, but feel free to just email me directly. All right, everybody, I'm going to stop recording and